Hello there, this is Dr. Bayliss from Women and Babies Hospital. Thank you for joining us for our next video blog regarding pregnancy and COVID-19 infection. I am gratified by the response that our first blog had and certainly welcome more questions coming into our OB providers and the hospital that we can try to address in future talks. I do have to admit to a mistake last week when I did the first blog. And that was, I forgot to emphasize the importance of our safety measures that we should all take. So please, when you're out in public, wear a mask. Wash your hands frequently with soap and water, and if not, use antiseptic frequently. And then finally, most important, is the concept, let's practice social distancing, staying 6 feet or more away from others to help contain this virus. Today, I'd like to focus on questions regarding the birthing of your baby. Should a woman continue to develop a birth plan in this time frame of COVID-19? Well, absolutely yes. As a facility, Women and Babies Hospital and its OB providers welcome birth plans that are developed by our patients. However, the birth plan needs to be flexible and it should be developed well in advance of arriving at labor with your OB providers. Our number one goal is to provide for the safety of the mom and her baby in labor and try to honor your birth plan as best possible. In cases of a seriously ill patient with COVID-19 or other conditions or other complications with this virus, considerations may have to be given and recommendations by your delivery team regarding the best and safest way to deliver your baby. Will I have a support person with me during my labor? Absolutely. At present, Women and Babies Hospital is allowing one support person with our laboring moms. The choice of that person is yours. It can be the father of the baby. It may be as a grandmother or your best friend. You, the patient, decides. All support people will be screened by temperature on their forehead and questions regarding possible exposures to COVID-19 before being allowed into the laboring unit. Should a person not pass that screening test, then you have the option of a second support person to take that person's place. So perhaps you want a game plan in advance. One thing in addition, make sure your support person packs their own bag, because that person is allowed to be with you for your entire hospitalization. However, if he or she were to leave the hospital after delivery, they will not be allowed back in for patient safety reasons. Should I ask for a cesarean section, or do I need a cesarean section if I have COVID-19 infection? The infection itself is not an indication for cesarean delivery. Standard obstetrical indications should help guide your delivery team choosing between vaginal birth and cesarean section. Some women, if critically ill or severely ill or experiencing other complications of the virus, may have a recommendation made for a particular mode of delivery based on best medical practice and what is to provide the safest care for you and your baby. What are the risks to my baby if he or she catches COVID-19 infection? Well, truthfully, this question is best answered by our pediatric colleagues. The true risks are clearly uncertain, but we are reassured that the numbers of newborn infants acquiring infection in the days after birth does not appear to be very high at all. Be assured that should your baby acquire this infection, coordination of that baby's care and the recommendations will be presented to you by your pediatrician with probable consultation with our neonatal specialists and infectious disease specialists. Thank you for joining me again for this quick session. I know it's very rapid, but I'd like to point you again to the Women and Babies website for our frequently asked questions. Also online, you can find very valid information regarding pregnancy at the Department of Pennsylvania Health regarding COVID-19, as well as the American College of OBGYN and the Center for Disease Control. These are extremely valuable sites that go into more detail than I can do here quickly. So please be safe out there, and as a new initiative has started in our county from all the healthcare providers of multiple systems. #I'm in. Please stay at home and be safe.